Welcome back to the Contact Lens Institute channel. I'm Dr. Stephanie Wu, and today we're going to be talking about cataracts and when you might need to get surgery. So I'm just using this eye model just kind of to give us a rough view of what cataracts are and where they take place in the eye. So you've got the front part of the eye, and then you've got your iris, the colored part of your eye, and right behind your iris there's a lens. And in this model, it's obviously very large, but in your eye, a human eye, it's only about the size of an M&M. So what happens is the lens, when we're born, starts off really nice and crystal clear like this. So when the images and when the light and everything we're looking at is coming through the eye, it's going through this really nice crystal clear lens. But what happens over time is your lens is like an onion. It's always growing new layers, so it's always getting thicker and thicker and thicker over time, and it's becoming more yellow or brown in color. You can see in this photo of the eye that the light that is bouncing back towards us is more of like a yellow, kind of a brown color. So as you can imagine, if you have that inside of your eye, if you have that yellow kind of brown color kind of coming through, that is called a cataract, which can impair your vision. The way that you'll know you have cataracts is it starts off usually quite small and really not super noticeable. So one of the first things you might notice is that glare at nighttime or lights on street lights or on a traffic light becomes very, very uncomfortable to look at. So you might start to see spokes or kind of double vision, or just it's not as crystal clear as it used to be. Those are some of the very first signs that you have cataracts. When your eye doctor is looking at your eyes, they are always going to be checking for cataracts to see if you're starting to develop them. Most people will start developing cataracts around 50, 60, 70 years old. And one of the main questions that patients will ask me when I diagnose them with cataracts is, when do I need to get surgery? And that is a wonderful question, and definitely want to answer that. When you have cataracts, they start off really small and they don't affect your vision very much. And in that case, you wouldn't want to do surgery. The risks really outweigh the benefits at that point. But over time, as the cataract gets bigger and bigger and more dense, it starts to affect your vision to the point where things are incredibly blurry, you're very bothered by glare, and you feel like your overall vision just isn't as good as it used to be, even with the very best glasses and contacts. When you get to that point, now it's time to consider cataract surgery. What's involved is the doctor will numb your eye, and they will use a very specialized procedure and specialized equipment to actually take the cataract out. So they will actually remove this cataract, and then they will replace the lens with a clear lens. So now we've gotten rid of that brown, yellow cataract, and now we've replaced it with a crystal clear piece of plastic, which will provide much better vision. Most of my patients that get cataract surgery, once they get their cataract removed, they notice that colors look more vibrant, the clarity of their vision is superior, and they're usually really excited to get the other eye done because they've noticed such a difference in clarity in vision. And in this other video, you can see how the cataract surgery affects the eye. As you can see in the pupil, it's nice and black and there's no reflecting light back that's yellow and brown. It's nice and crystal clear. So this is an actual patient that has undergone cataract surgery. This patient is experiencing much clearer vision. They don't have problems with glare and night driving, and their overall color perception is much better. So these are some of the benefits of cataract surgery. So if you think that you have a cataract or think that you might need surgery, make sure you talk to your eye doctor. They're always going to be the best person to help you make that decision. Hope you enjoyed this video. If you enjoyed this video, make sure you subscribe to our channel so that you can be the first to know on all these incredible and interesting topics. And if you ever want to book an appointment with us, don't forget to click the link below, and we're happy to chat with you and see if you're a good candidate for the contact lenses.